We're really thrilled that all of you can join us here today for a very special health policy Graham Rounds with Senator Jeanne Shaheen. The health policy Graham Rounds are part of Dartmouth-Hitchcock's We Care, We Vote initiative, a nonpartisan voter education program designed to educate and empower our employees to participate in the electoral process by voting in the 2020 elections, which are only 12 days away. So I hope all of you have a plan to vote. All candidates for federal and statewide office have been invited to participate, and recordings of all of our discussions can be found on the Dartmouth-Hitchcock We Care, We Vote website. Today, we'll hear from Senator Shaheen, who's currently serving in her second term representing New Hampshire in the United States Senate. Prior to her election to the Senate, Senator Shaheen served 3 terms as governor of New Hampshire and also served in the New Hampshire State Senate. She is the first American woman to be elected both a senator and a governor. Senator Shaheen sits on the Senate Appropriations Committee, Senate Armed Services Committee, Senate Foreign Relations Committee, and the Small Business Committee. Thank you for being here today, Senator Shaheen. I will first turn this over to you for a few comments, and then we'll look forward to engaging in a dialogue. And for those employees who are viewing, please submit questions for the Senator using the question and answer function on your Zoom platform at any time during this discussion. Courtney Tanner, who works in our Government Relations Office, will then bring the questions forward into the discussion. So I'll turn it over to you, Senator Shaheen.
Well, thank you very much, Dr. Conroy, and to Dartmouth-Hitchcock for giving me this opportunity to talk to so many of your employees. As I think we talked about earlier, we're about 12 days before the election, so it's coming up very fast and there's a lot at stake. I'm going to be very brief because I know what you all really want to do is have an opportunity to let me know what your thoughts are and also to ask questions. As you know, and you have really been on the front lines of this coronavirus pandemic, and that has really monopolized most of this campaign since it started. What I've heard from people is their concerns, the anxiety that has been produced, the number of people who are struggling. I worked hard in DC back in March to try and get help for New Hampshire. We got $1.25 billion for the state to distribute. We got extended unemployment benefits, help for hospitals and frontline healthcare workers, help for our small businesses. But a lot of that help has run out now and people are still struggling. I'm hopeful that we can get another package. I've been pushing for that in Washington. There have been a lot of obstacles. I'm still hopeful that if we can't get it done before the election, we will get it done immediately after so that we can provide the help that people need to get through this period. And I very much appreciate the work of all of you health people on the front lines of this pandemic. The first cases in New Hampshire, as you know, broke out in the Upper Valley. Dartmouth-Hitchcock handled that. You have been really out in front in terms of the response, and everyone in the state has appreciated that. I certainly have appreciated all of the hard work and the stress and the effort that everyone is dealing with, and I'm trying to do everything I can in Washington to support you. So let me stop with that and open it up for questions and hopefully be able to hear from all of you.
So actually, I can see some of the chat, and one of the first questions are, assuming you're reelected, what are your priorities for healthcare legislation?
Well, I'm hopeful that the Supreme Court is not going to overturn the Affordable Care Act. I think what we need to do is to look at how we improve on that to expand coverage to people who still don't currently have it. And I know that we can do that in a variety of ways. The ones that I support are a public option. I voted for that at the time we passed the ACA. I think allowing people to buy into Medicare or Medicaid is another way to quickly expand coverage to those people who don't have it. But we also have to address the costs of health insurance and of healthcare. And I know it's something you all are worried about at Dartmouth-Hitchcock. Some of the delivery system reforms that you all have worked on are very important to that. when we passed the ACA, we included an innovation fund that was designed to try and help address how to lower healthcare costs and how to provide healthcare better. Much of that money has been stolen, sadly, with efforts to undermine the Affordable Care Act. But one place that we know we can address healthcare costs, if we can get bipartisan agreement to do this, is around the cost of prescription drugs. It's something that I have worked on. It's one of the biggest drivers in healthcare costs, as I'm sure all of you know. We need to allow Medicare to negotiate with the pharmaceutical companies. That was prohibited under Medicare Part D when it was adopted back under the Bush administration. We need to be able to negotiate so that those costs can get lowered. If you compare what the VA can provide in prescription drugs versus what Medicare does and the cost of that, there's a dramatic difference. So that's one very important thing we should do. I have legislation that would keep the pharmaceutical companies from getting a tax write-off for all of their advertising. We assume that that's added to the cost of prescription drugs. I don't think they should get a write-off for that as well. We know we can allow safe reimportation of drugs from Canada and other countries. We have people in New Hampshire who are going to Canada, sadly, because they can get prescription drugs at such a lower cost. And then we need to allow generics to come to the market faster, because that would also help lower costs. So that's one of the first things that I think we ought to do. That's where I would start with healthcare. There are a number of other issues. I certainly would hope that we could get a major infrastructure package done as well that would not just address traditional infrastructure, roads, bridges, water systems, but also high-speed internet. I think one of the lessons from this pandemic is the deficit we have in parts of New Hampshire, certainly, in other parts of the country, with people who are not connected to broadband, and it's affecting the opportunities that they have. So that's a couple of places where I would start.
Yeah, just a follow-up question on the internet and broadband access. Certainly telehealth and telehealth services. That's kind of the silver lining after COVID is we really roared into telehealth because we had to take care of our patients. And I know that you were very helpful in removing a lot of the barriers to that. What's going to happen after the pandemic? Medicare historically has not paid for telehealth visits, but we would have not been able to care for our patients without it. So as you think about the future, what role will that play?
Well, as you point out, it's been one of the few good news stories from this pandemic that we've seen how effective telehealth can be. And one of the things we did was to raise reimbursement rates for telehealth, so they were equivalent to what people get for in-person visits. I hope that that's going to continue. I'm certainly going to support that. And I know there's bipartisan support for that. I was really impressed when I was up at Dartmouth-Hitchcock a month or so ago and got a chance to see very directly in real time the monitoring that you all are doing of emergency rooms and the other hospitals that are part of your system. It was very impressive, and it shows how much we can use telehealth in a way that makes us more effective in some areas. Sometimes it doesn't work, as you know, but that effectiveness is really important to continue. And for people in rural parts of our state, to be able to give them the care they need without figuring out how to transport them someplace to get that care is really important. So I'm going to do everything I can to continue and look at how we can improve that for people.
A question a little bit about COVID-19 and the economy. You know, it's interesting. We went up to about 16% unemployment, which is a tremendous amount for New Hampshire. And we're back down, I think maybe 6 or 5%. It feels like a lot of our unemployment issues are a little bit invisible. I don't know if people are unemployment or still using some of their savings. We're not necessarily seeing the impact on people that are coming to us looking for jobs. What is your take on unemployment across New Hampshire? Where are the areas that we really need to be concerned about? The hospitality industries have not recovered, even though manufacturing, everything else actually has recovered. But face-to-face hospitality and entertainment is still struggling.
Well, you're absolutely right. There are some industries that have recovered without, they're back almost to where they were, or even better. I've talked to some businesses that are doing better than before COVID. But we have sectors of the economy that are not doing better. And you point out hospitality, which is a big one, and a really big one for us in New Hampshire, where tourism is such a big part of our economy. Entertainment is another, where they have not been able to recover. Aerospace is another one where, as we look at what's happening in the aviation industry, New Hampshire has a growing aerospace industry. And if we don't see recovery in that industry, we're going to see some of our small subcontractors and manufacturers that are part of that industry get hit really hard. So as we think about what we need to do in another package of assistance, looking at those industries that have been hardest hit is really important. Another place that has not recovered is commercial real estate. Residential real estate is doing pretty well. Commercial real estate is not. And as we're seeing people continuing to work from home, that's a challenge. And we know now, as the eviction moratoriums have expired for several months now, we're beginning to see people who are being evicted, who are back on their mortgage payments. It's going to be a growing challenge in the future if we can't provide some help sooner rather than later.
Yeah. Now, one of the questions in the chat room is probably a common question people are asking. Will you cast a vote on Judge Barrett's confirmation next week, knowing what her impact could be on issues in this Supreme Court session?
Well, I've said I'm going to vote no on Amy Coney Barrett's nomination. And I am very worried about some of her extreme views that were talked about during her hearing last week, not just on the Affordable Care Act. While she really didn't answer the question and said, nobody knows what I'm going to do on that, it's very clear what her past writings and views have been around women's reproductive rights. Again, very clear what her past views have been. She signed on to an ad by an organization that believes you should criminalize people in vitro fertilization, for example. That's an extreme view. Yeah. I was disappointed to hear her refuse to acknowledge that Medicare is constitutional, her refusal to speak up against intimidating voters in polling places, to not embrace the peaceful transition of power from one presidential administration to another. I mean, a number of views that made me really concerned. And one of the challenges I think we've got with the Supreme Court is that we are seeing it being used under this administration as a political arm. And one of the important things about our rule of law, our Supreme Court, and our courts in the country is that people need to believe that they are objective arbiters of the law. Yeah. And when that gets undermined, it really is an undermining of one of the basic institutions of our democracy. And that worries me.
Yeah. Let's talk a little bit about Medicare. A lot of our patients rely on Medicare as their source of health insurance. A lot of people don't know that when Medicare was developed, a lot of seniors in the US were living in poverty because they couldn't pay for their health care. They hadn't saved enough. And Medicare actually was a really important kind of public health program to make sure these seniors receive their care. Since then, it's become just a giant insurance product. So big, however, that the Medicare Insurance Trust Fund may be unable to fulfill its commitments. And some people are predicting by 2024 or sooner, it will have some challenges. So how do you approach that from a senatorial perspective? There are many of our patients and probably even employees that actually are betting on Medicare being available. and that seniors can continue to get the care they need.
Well, absolutely. And everybody I've talked to who's on Medicare depends on it for their health care and is very supportive. So it's interesting to hear people complain about government-run healthcare, but this is a government-run program that has worked very well for seniors. We have seen under this administration efforts to cut funding for Medicare that would have had significant impacts to the care that's provided. Those have been soundly rejected by both Republicans and Democrats. So I think as we look long term at how do we address the shortfall in Medicare, one of the things that we did when we passed the Affordable Care Act was to lengthen the life of the Medicare Trust Fund by over 10 years. We did, when we passed the Budget Control Act back in 2012 or 2013, it also increased the life of the Medicare Trust Fund. But clearly, we need to do something now or in the next couple of years, because we are going to have problems. I think we ought to think about what we did back in the 80s when Social Security was in trouble. And what Ronald Reagan did was to appoint a commission of senators and members from both parties and had them make recommendations for how to address the problems. They met, came back fairly quickly with some recommendations, and because it was bipartisan, because there had been input into it, people were able to enact it in a way that included public support. So we've got to do that now as we think about the long-term needs of Medicare, because whatever we do has got to have the support of the public if it's going to be successful.
Now we have another question from the audience. Given that feel like we're in the second phase of the pandemic, it's a different type of experience than we had in the spring, but there still are really important public health initiatives that we all need to embrace. What would you encourage people to do from a public health perspective to really help stem the community spread of the virus?
Well, it's really unfortunate that the response to the virus has become so political, because this is about public health. One of the points that was made to me by some medical experts is that one of the most important things in responding to a public health emergency is consistent messaging, so that people hear the same guidance. And that's been missing in the response to this pandemic. What we need to do is follow the CDC guidance, mask wearing, social distancing, hand washing, and all of the sanitation. We need to, I think we need to fully invoke the Defense Production Act, which really hasn't happened yet. Mm-hmm. We've moved on that, but here we are 8 months into this pandemic, and we still aren't producing in America all of the things we need to respond to the pandemic. We need to continue to invest in therapeutics and the innovation that's going to get us ahead of this pandemic, vaccines. And long term, we've got to look at our public health system in the United States. I had a really interesting conversation with Dr. Redfield, who's the head of the CDC. This has been a couple of months ago. And he was talking about his interest in reforming our public health system and a realization that we don't have, if we look at comparison with South Korea, for example, which has a very different public health system, and the way they've been able to address the coronavirus has been very different than what we've been able to do here. So I think there are some long-term reforms that we really need to look at as we get past this pandemic.
Yeah. Let's shift and talk a little bit about pharmaceuticals and specifically 340B. Many of our rural hospitals that take care of a lot of underserved patients benefit from that. Dartmouth-Hitchcock benefits from it. The pharmaceutical companies, it's such a small part of their business and small part of their profit margin, but they keep going after it like it's something that's critical to the survival of their industry. Can you talk about how you're approaching this from a leadership level. I can only imagine if we were to lose this program, what the escalation of out-of-pocket costs would be for many of our patients.
You're absolutely right. And I think one of the reasons we've seen the pharmaceutical companies respond the way they have is because right now they're basically getting a free rein to do whatever they want. And I think if CMS were willing to engage more with them to put some pressure, if we had a real bipartisan legislation that would signal that we aren't going to accept what they're doing to roll back this program, I think they would be responding differently.
Mhm.
But, every time we get to close to action, whether it's on reimportation or surprise medical billing, which has been a huge issue, what we see is the lobbyists in Washington come together and work to prevent action from happening. And we really need to get past that because, as you point out, there are a lot of people who are depending on that program in order to be able to afford their medications.
Yeah, it's critical. So let's shift to talk about the vaccine, maybe a light at the end of the tunnel. Um, how are you and your colleagues really talking about the challenge of if we have a successful vaccine, which we'll hope something might be identified by the end of the year that will then have to have a little bit more human testing. How do you vaccinate 300 or 400 million people?
Well, it's a huge challenge. And I think particularly if there are significant portions of the population who don't have any faith in vaccines to start with and who are worried about the safety of a vaccine. It's been one of the reasons I think so many of us have been concerned about efforts by the administration to interfere in what the FDA and what guidance that the CDC has provided and what the FDA is saying. A month or so ago, they talked about strengthening the safety precautions and the safety regulations around approving a vaccine. And we immediately heard a response from the White House that tried to put pressure on the FDA to roll back those increased safety precautions. I am encouraged by the pharmaceutical companies who are working on a vaccine and the position that they've taken to say we are not going to put anything on the market that we don't believe is safe. I think that's reassuring. But we do need to prepare. We got a call last spring from Smith's Medical in Keene that produces syringes. And one of the things they were saying to us is that they expected to be very involved in any vaccination program and to produce a lot of the syringes that would be needed, but they needed to order the materials in advance and they didn't have a contract yet. So doing some planning is really important.
Yeah. Well, I know that, we run a very busy flu shot program here in the Upper Valley. We probably give 9 to 10,000 people flu shots every single year. And I have to say, we've adapted that. Instead of long lines through the facility, we actually have people driving up in cars and can do up to 700 people a day.
Wow.
Yeah, they're a very effective teams. And we're actually doing that not only across Dartmouth-Hitchcock and in Lebanon, but we're in Plainfield and Claremont and a lot of the more rural areas, so people don't actually have to drive up here. I've got to believe that there is some thought and planning about how do you actually vaccinate that many people and how long does it take? And I think we are talking among our healthcare providers, who goes first?
Right.
And how do you make those decisions?
And those discussions are underway. I have to say there's not been a lot of transparency around those discussions to date. And I think it would be helpful for the public to have a better understanding of that. I remember when the polio vaccine came on the market and I was in second or third grade and being lined up in school and everybody got the vaccine and my parents were thrilled that we were able to get the vaccine in school because they had been so worried. And I hope we will get to that point where people will be reassured about the safety of the vaccine. And I think that starts with our leaders getting vaccinated publicly, showing people that there's nothing to be afraid of.
Yeah, yeah. Well, I think we're at the end of our time, Senator Shaheen. We really appreciate your insight, your support, everything you've done for the state of New Hampshire and certainly for the people in the Upper Valley. Is there anything else you'd like to say to our viewers?
Well, there is a lot riding on this election. It is really very important. I hope everybody is going to look at all of the races and make a decision and get out and vote, because our democracy only works if we all participate in it. And so I hope all of you will, as Dr. Conroy said, make a plan to vote, make a backup plan to vote, get out there. You can vote, still vote absentee, and you can vote on election day, because everyone should have their voices heard.
Yeah.
So thanks very much for this opportunity.
Thank you, Senator Shaheen. I'll be there at 7 in the morning.
Yeah, well, Madbury doesn't open at 7, but I'll be there when it opens.
All right, great. Thanks, everybody. Thanks, Senator Shaheen.
Bye, thank you.